So if a hospital were to implement patient monitoring on its existing Wi-Fi networks, what would be the best practices for it to follow?
The first step I would ask for is the CAD drawings or the drawings of the facility. I would have the clinician or the clinical team outline where they'd want to have coverage for that patient, meaning all the rooms, all the hallways, all the elevators, where that patient would travel, the radiology, the cardiology, cath lab, cafeteria, anywhere that patient would go. Then based upon that, I would use a predictive model that could take into account. I'd also get on the phone with the facilities and understand the age of construction of facility, to understand the wall compositions, the tile, the types of rooms, where they'd have the bathrooms located, any isolation rooms, any lead line rooms in radiology. And I could take that understanding after conversations and discussions and build a predictive model of that facility. Then I could turn back to the organization and say, all right, here's what you need to meet your clinical requirements based upon where the patient's going to travel. Here's technically the requirements. Then they could go back to their integrator or whoever they use and say, based upon our existing architecture that we have, we need to add or remediate this amount to meet these requirements.
Now, what would you say the time frame would be, a typical time frame for this whole process?
From a design standpoint, in terms of getting all the requirements, doing the design, and understanding the facility's requirements, it's not more than maybe a week. It's very quick.
Wow.
If you really can get the appropriate resources on the phone, talk to them, understand the requirements, it can really shorten this time cycle, but also can lessen a lot of the costs. Because a lot of the costs were usually by sending somebody on site to walk around to do a site survey, which, a large amount of cases you don't have to do anymore.